Hi, my name is Dr. Mark Smesko. Here at Ankle and Foot Care Centers, we're spreading awareness of peripheral arterial disease, or PAD, which can affect 18 million people in the United States. So what is PAD? PAD is a vascular disease that affects the lower extremities and is often caused by plaque buildup as well as hardening of the walls of the arteries that impairs blood flow. As I discuss with my patients, it's crucial to discover this early so we can prevent possible complications down the road. So what are the common symptoms of PAD? Patients can experience pain when they walk. They get cold toes, cold feet, loss of hair growth on their feet and ankles. They can get burning, tingling, numbness in their feet and legs, which can affect their activity level. Patients at first may experience something called intermittent claudication. Essentially, this is when a patient gets up to walks a certain distance, and they get cramping in their legs. This forces them to sit down and stop that activity. They rest for a few minutes, they're able to get up and walk again, and a lot of times it's that same distance that starts to cause the cramping. As the PAD progresses, the patient may experience rest pain, which is when a lot of times they lay in bed at night and they get cramping and pain so severe that they have to get up, stand up, walk around in order to reduce those symptoms. So who is at risk for getting PAD? First and foremost, patients with diabetes are at risk. A patient who is diabetic and over the age of 50 has a 1 in 3 chance of getting PAD. If you're diabetic and also have PAD, you're at a 10 times greater risk for amputation. What are some of the risk factors, you may ask? High blood pressure, smoking, problems with your kidneys or kidney disease, uncontrolled blood sugars, as well as increased age can affect your risk of PAD. So how do we treat and prevent PAD? First, you should try to get your blood sugar under control. If you're diabetic, blood glucose management is very important. If you're a smoker, you need to stop smoking. Keep your blood pressure under control, and also stay active, stay moving. This will help reduce your symptoms of PAD. When I see a patient in the office, the first thing I do to evaluate for PAD is to check your pedal pulses. You should use your index finger and check for a pulse on top of the foot as well as on the inside of the ankle. You should feel a heartbeat or a pulse there. If I feel those two things, the chances of you having PAD is very low. If I don't feel the pulses, then I move on to a non-invasive arterial vascular exam. This is a non-invasive test that essentially puts blood pressure cuffs on your legs, feet, and toes and tests the pressures down the legs. It'll also give me waveforms to evaluate to see if you have PAD. If they come back abnormal, then I send you off to a vascular specialist to be evaluated and treated by them. This could be anything from just watch and wait to a pill to actually a interventional surgery to reopen the arteries to restore blood flow to your feet. Sometimes patients with PAD may also experience cardiac issues. About 60% of patients with PAD may also have coronary artery disease. This is why it's so crucial to see the symptoms early to prevent complications down the road. If you or someone you know has any signs or symptoms of PAD and would like to see one of our physicians, please contact one of our 20 offices and we'd be happy to see you.